Deborah Harding sent us this question of both of you, and we'll start with you, Fred. What specific solutions do you recommend to make health care more affordable and accessible to everyone in Southwest Michigan?
Well, first of all, we've got to repeal Obamacare, and hopefully that will occur in the November election, that we'll get a Republican Senate, we'll keep the Republican House, and we'll take the White House so that we'll have the muscle to get it done come January next year. Yes, we do need health reform, and we need a whole number of different options to try and reduce the cost of health care. One of them that I've long supported, and we actually moved through our committee, was tort reform, malpractice reform. This is the Congressional Budget Office has indicated that we could save perhaps as much as $60 billion if we had a malpractice plan, a tort reform plan. It's interesting that the president called for tort reform. When he pushed Obamacare at the very beginning, we tried to get that included as part of a Republican package. We were denied by Speaker Pelosi to even offer it as an amendment, either in committee or on the House floor. But we need competition-based health care, not government-run health care. So competition, what is that? Well, that's allowing folks to purchase health insurance across state lines. That's allowing for ideas like health savings accounts to encourage employers particularly to help individual employees with plans where they can focus on diet and exercise and a whole number of different things to try and see some real savings. We need to allow associations. We've passed this in the House a number of times without the Senate moving forward, but we need associations, whether you're in a farm bureau or a chamber of commerce, to be able to provide health insurance plans. It's an area where we could have pooling and a broader base of folks able to do that. We need to allow folks to purchase health care across state lines, and we need incentives for employers to provide health insurance. You know, Obamacare, when it passed, the big thing that the president said was, if you like your health insurance, you can keep it. For millions of folks, that's not going to be the case. Health savings accounts are pretty much going to be gone. Medicare Advantage, which helps seniors as part of the Medicare supplemental plan, nearly 50% of Michigan seniors are going to lose that coverage. So it's actually going to take away coverage, not provide it. And rather than having a government-run plan, and no one knows what Lansing is going to come up with in terms of their state, in terms of the state legislature and trying to put together a plan, but it's going to force a lot of folks to leave the current plans that they have and go into the state plan, and they're going to lose what they have, and it's just a really bad idea. So last two things, we need to make sure that insurance companies do not discriminate against those with a pre-existing illness. I think that's vitally important, and there's been broad support for the idea that children up to age 25 or so be maintained on their parents' policies. I think those were some of the items. We had about 10 or 12 different ideas that were part of a Republican substitute 4 years ago. Sadly, we weren't able to get that thing through. But if we are able to repeal it, you'll see a number of ideas come back in a Republican-led Congress and signed into law by a Republican president.
Jack Hoogendyk, same question.
Thank you very much. Well, I wrote down some real quick notes, and much of what the congressman just mentioned are things that are on my agenda as well. And I would say that this is one question where you're not going to see a great deal of difference of opinion. As you know, Mr. Upton did vote against Obamacare, as all the Republicans did back 2 years ago. I would agree. Large health savings accounts are something that would help to reduce the cost and allow people to have more personal empowerment over their health care decisions, the purchase of insurance. Deductibility is an important factor. You know, right now, employers can deduct what they spend on health care insurance and health care for their employees. And in fact, it's one of the biggest tax write-offs or tax incentives out there. Unfortunately, individuals can't do that. They can't take a write-off on their purchase of health care. And the problem with that is it then causes a situation where you have employees who tend to be tied to their employer. They're not going to be as quick to look for another job, look for advancement, or if they lose their job, they're really in a world of hurt because they lose the insurance as well. Whereas if we allow them the deductibility to purchase insurance as individuals, then that goes with them wherever they go, to whatever employer they work for. So I think that's an important thing that we could have done, or that we would do if we could repeal Obamacare. Tort reform is another thing that I would agree is very important. We need to, as much as we can, push healthcare back into the private sector, and introduce the concept of more personal responsibility. And the problem that you have when the government is providing you with a service is you start to lose some of that personal responsibility. Had a conversation the other day at a meet and greet with a couple of EMTs, guys that drive ambulances, and they were talking about people who they don't have a health care plan, they don't have insurance, but they know that, hey, I don't need to worry about it. If I need a ride to the hospital, I'll just call the ambulance. I'll just dial 911 and they'll just come, and they know they don't need to worry about it. And it's frustrating to these guys. Of course, they do their job. They do it diligently. It's not for them to say. But they see what goes on, and they say, this system that we have now does not work, and it's going to get worse with a national health care plan. I have some concerns about insuring people for pre-existing conditions with a government guarantee. I think that's something that we need to allow the private insurance companies to do for themselves, to put together high-risk pools or whatever the case may be. And I also have a concern with government telling insurance companies, you have to insure kids up until age 26 if they're living at home. Again, what's going to create better choice, better quality, and better prices is when the private sector has the control over the decisions, the individuals and the companies that provide the service, rather than the government mandating anything to insurance companies.